Thank you, Madam Chair. Members, good morning. I'm going to turn it over to our Deputy County Manager of the Health and Wellness Service Team, Kathy Hadeen, and I'll let her open by explaining a little bit more about the continuity planning that has taken place in public health to ensure that we have seamless service delivery response during the pandemic as she dives into her update, and then we'll come back for a few final things from me.
Thank you, County Manager O'Connor, and good morning, Madam Chair and Commissioners. Today's day 2, officially, of being Deputy County Manager for Health and Wellness. I'm excited to be in this role. I will also be continuing in the role of the Public Health Director through this winter. As you'll hear, our COVID rates continue to go up. It's a very serious time. It's going to be a very difficult time, I think, to get through this winter and to provide kind of continuous leadership through the department. We all felt as a department leadership team within public health that this was the right direction to go for now. We have great leaders in place. I have asked Manager Laura Anderson to step into the Public Health Incident Commander role, and so we will be transitioning that soon. And I've also asked our Administrative Manager Diane Holmgren to step in as a Deputy Public Health Director to help me through this process to ensure that the Public Health Department has what it needs, especially as we go into a budget year. So we are all doing well. We'll continue to be strong and move forward together, and I'm happy to be able to play both roles with the help of a lot of people to get through this. So thank you, and we will move on to our COVID situation update. We will move over to the dashboard as we go through the stats. In Minnesota, you will see that 153,620 people have tested positive for COVID-19. That's almost 30,000 additional people in the last 2 weeks. And my last report to you, we had increased by 20,000. So that can show you just how fast this is spreading across our state. There continues to be a record number of people testing positive across the state, with multiple days in the last week with daily cases of pretty close to 3,000 or higher. This is very serious, and we need to make sure that we're doing what we can to slow this spread. Total cases requiring hospitalization to date in Minnesota is 10,437, with 2,729 in the ICU up to date. Those two numbers daily continue to increase. Hospitals continue to watch and monitor the number of beds that they have and work on plans to make sure that they can address all the issues that are coming into their hospitals. There have been more than 2.9 million completed tests for about 1.9 million people across our state. We do continue to increase testing, and we'll talk about that in a bit. We can move over to the Ramsey County dashboard. Like the state, we also saw a record number of cases per day last week. You'll see a couple of high numbers there with 249 and 250 on October 26th and 27th. Those days blew away our last highest numbers from the weeks before. If we scroll further down, you'll see the cumulative case rates have gone up to 272 people per 10,000 residents in Ramsey County, and continues to go up for all metro counties. Our weekly case rate has moved to 15.5 cases per 10,000 residents, and as we scroll down, you'll see the positivity rate as of October 17th was 5.8%, and that rate continues to climb. Let's scroll down to the cumulative totals. We've had 15,005, it looks like my number is a little low, 15,860 confirmed cases in Ramsey County. That is more than 2,000 that we had in the last 2 weeks. That number continues to rise quickly. Unfortunately, we've lost an additional 33 people in the last couple of weeks, and we stand at 378 people that have been lost to COVID in Ramsey County. If we move down to the demographics, I do want to talk a bit about age. The Minnesota Department of Health plans to focus testing campaigns on 18 to 35-year-olds. These age groups are getting and spreading COVID-19 more quickly than any other age group, with 15 to 17-year-olds catching up quickly. It's important that these age groups get tested now. Upwards of 40% of this age demographic are asymptomatic and may have very few symptoms. It's important, though, to say that there are others in this group that have suffered significant symptoms. The issue is their ability to spread COVID to others, especially during this time of year when family celebrations are about to happen. We urge everyone to access testing. The good news about these age groups is that when they do test positive, they are doing a good job of isolating, and they're also doing a good job, if they've been exposed, of quarantining. So I would like to move over to the testing site where we can see where we can access testing right now throughout Ramsey County. We have one more Saturday testing event at Aldrich Arena scheduled for this Saturday, November 7th. We also have testing events scheduled in November and December at the Consulate of Mexico. You can visit our COVID testing site for information on time and watch for additional testing sites as we secure a building to provide COVID-19 tests during the winter months. Finally, the state of Minnesota also opened up a saliva testing site at the Roy Wilkins Auditorium located at the St. Paul River Center. This is the first saliva testing location in the cities of Minneapolis and St. Paul. This site is free and open to anyone who thinks they should have a test. Whether or not you have symptoms or not, you can go there and get a saliva test. There is limited free parking on the roof of the St. Paul River Center for people to utilize. Testing is available 7 days a week from noon to 7 p.m. weekdays and 10 a.m. to 4 p.m. on weekends. Vault Health is the organization running the saliva testing events in partnership with the Minnesota Department of Health and the State Emergency Operations Center. Vault runs the labs in nearby Oakdale, which means results turn around within 24 to 48 hours. There is no nose swabbing at these events. You simply provide a saliva specimen into a tube. Ramsey County Racial Equity and Community Engagement Response Team and our Public Health Community Liaisons, along with our testing branch, will continue to partner with Vault and the State Emergency Operations Center to ensure consistent messaging and partnership while they provide testing at this temporary site. The State Emergency Operations Center testing team does ask that you register for an appointment, but they will take walk-ins. It's a completely paperless site, so if you have a smartphone, bring it and start the check-in process while you stand in line. If you don't have a smartphone, they will have a device on site for you to use, and there will be staff there to assist you with any questions you may have. This is a big deal for the city of St. Paul, for Ramsey County. It's yet another way to increase access to testing that is open to everyone. You can go to www.ramseycounty.us/COVID and click on the testing sites link to find and register for an appointment. I will now turn it back over to County Manager O'Connor.
Thank you, Deputy County Manager Hadeen. I wanted to update the board on the continued conversation with mHealth Fairview and the Bethesda location. Last week we had a positive pre-application conference with the CAP board, the Capital Area Architectural Planning Board. We're going to go with that. I'm getting some head nods, so I think I got the acronym correct. I appreciate the opportunity to have met with their staff. It was a pre-application conference so that the permitting application could be submitted this week so that we can meet with the CAP board a week from this Friday, and so that that can start the 30-day public comment period that would allow us to be completed by, I believe the date is December 13th. That's the current timeline under which we're working. They are scheduling their December meeting still with their CAP board members. We anticipate it will be on or immediately around December 13th. And we ask that if that not feel like it coming to fruition on that date, that they let us know so that we can have further conversation here. In the realm of community engagement, we had a community dialogue that a number of commissioners were a part of last week. Thanks to all the community members who tuned in and were a part of that conversation, and to all the staff that were a part of making it a success, showing up and being a part of that opportunity to listen and engage with the local neighborhood and the broader community. There is a weekly newsletter. You can Sign up to receive it at ramseycounty.us/Bethesda. It goes out every Friday with all the information that we can share. As noted in last Friday's newsletter, there is now a phone number that has been set up as well for community feedback. That phone number is 651-266-8390. 651-266-8390. We commit to responding within 24 hours on business days to any messages left at that number. We have another community town hall scheduled on Monday, November 9th at 5 p.m. And we continue to encourage residents and interested parties to go to our website. That is the place where we're providing the most up-to-date information as we go. On the request for qualifications related to services at the site, we are hoping to release an RFQ by the end of the week. It's a little bit of a challenging week with other events going on, so we'll keep you posted as to the timing of that as it all comes to fruition. But things are moving along well there. And last Friday, Ramsey County representatives from the city of St. Paul and mHealth Fairview met to discuss clinical service offerings for Bethesda. There was a specific focus on mental health, chemical dependency, urgent chronic care, and dental health. And all of that conversation needs to correlate with the RFQ process for other community partnerships that we will need at the site. So we'll continue to keep you updated on that in the weeks ahead. Turning to the final topic I have around service delivery and our current structure and looking forward, the October service delivery form should be posted today or tomorrow now that we're at the end of the month and we begin the November process. So this is the documentation we're doing monthly to continue to check in across the organization, see where we are and where we're going. Just a couple of key themes I wanted to highlight for you, and then one big announcement at the beginning of the form. Based on the public health information and the uncertainty employees are facing as they enter into the holiday season, concerns about more face-to-face service delivery interaction due to weather, and the continued closure of schools across much of Ramsey County, or limited open schools in many cases, we're announcing that our work in the current arrangement will continue to last until at least next spring, which we are defining as April 1st of 2021. Those dates are similar to organizations around us. They're not exactly the same. More important than a specific date is an acknowledgement that this is a point of fear and concern among employees, not being sure what is going to be the scenario as we hit January. It's important for us to help them continue to focus on their work in the meantime and recognize that in limited circumstances where we need to make changes, we've made those changes and we continue to be successful in our current operating environment. Along with the conversation about April of 2021 is a recognition that beginning in January, we'll be reaching out across this organization to talk about our future state of what our organization looks like as people do come back into work arrangements. Simply put, it will not look like it did in April of 2019 or in April of 2018. And we're excited to move into what the future looks like. That is not only related to the pandemic, but the idea that we can learn from the technology that has come on board. We can learn from the positive aspects of what we've learned while balancing that with the challenges that our current work arrangement has also brought to families. I look forward to talking with all of you more about that as we hit the end of the year and begin to move into next year. Final updates on the service design forms as you get a chance to look at them. I have asked the library to specifically provide an update to the board. I know that's been an area with questions in the past. There is some information here about their planning and the direction they're going, but you can expect within the next week to receive a specific update on library plans and express delivery and rollout, how that's coming along. And then I'll finally end on just the broadest part of the theme that comes out of this time's forms. When COVID-19 first came to Ramsey County in February or March, the theme of our work was very much around unknowns about a virus where there was very little known about how it was spread, where it was, how quickly it would spread, and it was fear of the unknown. It then became a conversation about the lack of protective equipment, PPE, and concerns about being able to do our work effectively without appropriate PPE, and concerns about our technological capacity. I think we've entered our third phase at this point. We're actually seeing a lot that technology has been implemented in many ways that has provided help to the organization, and PPE is readily available in ways that it was not at the beginning of the pandemic. There are still unknowns about the virus, but those are not the things that people wake up with as the first thought every day. Instead, the thing that you see the most when you read all the forms are concerns about service delivery and the gaps that develop over 9 months, where we continue to see that non-face-to-face interaction cannot be as successful. There are places like mental health and chemical dependency, child protection, adult protection, where there are no substitutes from the role that our staff play during face-to-face interactions. They have, in many of those cases, already been doing limited face-to-face work, but as we move into winter, there is a desire to continue to work with public health and ensure that in those areas we are doing all that we can to best serve this community. So we're going to continue to work on a case-by-case basis to think through the best ways to take that work on, but we are clearly now into a period of adjustment as we hit winter, and the largest fear right now is the concern of a flu season alongside COVID and what that could do to our staffing availability across our organization. We don't have all the answers, and I don't pretend to bring them today, but I wanted to highlight those areas as issues that we continue to work through together, and we will continue to surface that as we go in the coming weeks. With that, Madam Chair, Deputy County Manager Hadeen and I would stand for any questions or comments that you all may have. Thank you for the time.
And thank you again for the update. Commissioner Mattis Castillo.
Yes, thank you, Madam Chair, and thank you for the really thorough update. I wondered if I could just ask Deputy County Manager Hadeen, if we've heard a lot of data, we get a lot of numbers. This has been going on for several months, and people have kind of become immune and numb in some aspects. And so I just wonder if you could share, what are the things that we are asking people to do in order to keep safe? I think that we've kind of relaxed in some ways and in some cases, especially in our younger population. And as information comes out about whether it can be on surfaces, whether it's tracked on our shoes, those kinds of things, you could just share what's the best way for us to keep ourselves and each other safe.
Madam Chair and Commissioner Mattis Castillo, thank you for the question. I think it's similar to a theme question that Commissioner Ortega was talking about the last time we spoke. The people are just, they're getting tired. It's the pandemic fatigue is real, and people just want their lives to go back to normal. But I don't know that we'll see that normal for a while, and so we need to continue to mask. You see that we're wearing our masks today, even when we're talking with case rates so high, and even when you're trying to space out and but you're in community, there's still risk. So making sure that we are continuing to social distance, that you know who your bubble is and who is in your family and who you've been around, but outside of that, continuing to take special care to be distanced from people. The masks are such a big thing. There's a lot of great information and a lot of great articles that you can look at and watch, even videos of how droplets are spread and how much a mask can help when you're indoors and around people and keep that from spreading to others. So, our community liaisons and the racial equity and community engagement response team especially has been doing such a great job with the Mask for All. They'll continue to provide masks to community through events with partnering during our testing events and making sure that people have access to masks. It's the biggest piece right now, is making sure that you can keep your distance and keep a mask on. It's the biggest thing that people can do. As well as if you've been around somebody who has COVID, isolate, quarantine, stay home. If you yourself are not feeling well, make sure to go get a test. We now have enough tests in our community. We have the Saliva testing site. We have the public health testing sites that people can go and get one. You still can make an appointment or you can show up. We have enough to help people right now. So getting tested, wearing a mask, staying distance, and when you're not feeling well, stay home. Those are the biggest pieces.
Thank you very much. Commissioner McGuire.
Thank you. Thank you, Madam Chair. I appreciate all of the reports, and thanks for that reminder, Deputy County Manager Hadeen. I have a question about the saliva testing that's going on at the Roy Wilkins. Is it possible that people can do a drive up if they have a person that has mobility issues? Can they drive up and have that done, or is that not a possibility? And if we're the only place in the cities, I expect if we don't do it, then there's no place where people with mobility issues can get saliva tested.
Madam Chair and Commissioner McGuire, that's a great question, and I would love to get back to you with an answer that is yes. I would need to check in with Vault Health. What I know about Vault Health is that they are very accommodating and that they are partners in this and that they want to be able to work with our community to make sure that their tests are accessible. The Roy Wilkins site is a temporary site. There is work being done with the Sears site that does offer drive-up capability. And so as that site gets up and running and it becomes the semi-permanent saliva testing site, that option will be available. For now, I will respond back to you and the commissioners with the answer, but I am hopeful, knowing Vault and how accommodating that they will be able to help with that.
I really appreciate that on behalf of the board, but thanks to Vault and to you for that flexibility. Appreciate that, because I've been getting that question from people. So thank you so much for that and for all your work.
Thank you.
Thank you. I don't have other hands up. I would just repeat to thank you very much for the complete update that you have provided, for all of the work that is going on for testing and for continuing awareness. As you have said, this is not going away. As soon as when it arrived, we had thought or hoped, and we are learning more and more beyond the fear and beyond the shock of the start of this, how to endure through it, how to keep ourselves, each other, and our communities safe. And in fact, how to care through masking and through all of the appropriate ways of social distancing and staying at home, taking care of ourselves. So thank you so very much for keeping this in front of us weekly, for the information on our site as well, and for all of the special work that is going on as we conduct all of our work as well in our response to COVID. Looking back, there are no further questions. I will turn back to County Manager and Deputy County Manager Hedin for any further or last comments.
Thank you, Madam Chair. I would only add one last piece, which is we continue to learn a lot about ventilation. And I don't even just mean HVAC systems, although we continue to do a lot of work with public health and property management in that space. The simple act of opening a window matters. And many of our buildings, interestingly enough, in Ramsey County, particularly in St. Paul, were built during a time when that was a part of the plan more than 100 years ago. And you can read a lot about that. There's visualizations. But part of our work is going to be to think about opening windows this winter in different ways to create airflow through rooms. And what's old is becoming new again. So just to the advice that we're working on, if there's someone in a room with you, I mean, this is not a public health director saying this is a lay person, but if you're in a room with other people who you don't spend a lot of time with, but you need to be in close proximity and you have access to open a window, open the window and put on a layer if you need to and wear a mask. It's better than just wearing a mask. And together we'll figure out our way through. That's all we have today, Madam Chair. Thank you for all the time.
Thank you very much. And so we're at the point in our agenda when we have our administrative items. Commissioner Maris Castillo.
Yes, Madam Chair. I would like to move item number 5,